everyone, let's cover filler 101. So all the things you need to know if you want to come in and get filler. So first off, what is it? This is hyaluronic acid. This is something our body naturally has, but we start losing it after about age 20. We lose 1% of our collagen every year. Say that again. If that doesn't make you want to book an appointment, I don't know what will. But anyway, we can inject something called filler, which is hyaluronic acid, and you would see it right away, and it can last up to a year. So it can restore some of what we lose with aging. So what I like to do is get patients to come in for a full facial balancing assessment. So instead of saying, hey, just my under eyes bug me, or just this bugs me, my jawline, or whatever that might be, hey, let's come in and let's take a complete look, because sometimes what bugs you is just this little hollowing right here. But if you look at your cheeks, for example, we lost a lot of volume in our cheeks. We have no structure. So if we actually just re-support the cheeks, then guess what? The under eye problem is going to fix itself, and you actually don't even need filler right there. Or sometimes we have a weak jawline, but guess what? If you don't have a chin support, whenever you turn to the side, you'll have an amazing jawline, but your chin will be crazily recessed. Or some people come in for lip filler and they keep wanting lip filler, but they have no cheeks, they have no piriform aperture support, they have no chin support, and then their lips start to look ducky. So it's my job to look at your face as a whole and then put little small touches of filler here and there to keep you looking natural but balanced. So let's talk about areas that we can inject. So first off, starting at the top of the face, we can inject temples. So as we age, we start to hollow out on our temples, and that's what causes everything to start to fall down. So if you look at your face and you have hollowing here, your cheeks poke out, and then right underneath it kind of dives in, then it's time to start getting some temple filler. So I actually need some myself. So this gives it that youthful kind of fullness, and I don't want to say fullness, that's a terrible word, but that youthful baby feature that just makes us glowing, bright, and helps lift things up. Next would be cheeks. We support the medial cheeks and also the lateral cheeks. Sometimes patients have full cheeks, but they still come in for that facial balancing, and we do more of a contour approach where we lift with filler. So it's not always just to add bulk, it's to add contour. I like to look where the light's reflecting and where we have that contour underneath. Just like whenever we do our makeup, we put highlighter on the top and then we'll do bronzer or contour underneath to make it pop. Same thing we can do with filler. It's pretty amazing. And then tear troughs, under eye filler, that's to help blend in the hollowing. But not everybody's always a candidate. If you have puffy under eyes, or if you pinch that skin and it kind of just stays up in a tint, it doesn't snap back down, that's from decreased elastin. Sometimes patients have darkness, but it's not from a hollow. It's actually from pigment, or it's from the vascular structure. So you might be a better candidate for something like PRF gel or for medical grade skincare. So it's not a one size fits all. Smile lines. So these are called nasal labial folds from the corner of the nose to the corner of the mouth. A lot of people don't like when they put on makeup, it kind of settles in their makeup. So we can add a little bit of structure right there to kind of give it some support. Now, I don't want to make you look like a monkey. I don't want to make you look too full right there. So I'm very conservative in that spot. The piriform aperture is a little triangle hole right here that it gets bigger and deeper as we age. So sometimes I can give it a little support right there to help lift our lips up and help just support overall the lower face. It also means we need a little less filler in the smile line. Now moving down on the lower face, these are called marionette lines, the corner of our mouth to our jawline. And that's what's responsible for pulling things down. So if at rest, you have a resting B face, you might have that marionette line that's kind of starting to form. That can be from the muscle, but that can also be from volume loss. A lot of people start to get shadowing right here, kind of like in a little triangle itself. With filler, we can soften that shadowing to make it look almost like you have a filter in real life. Above the chin, there's a little crease some people have that's a little bit more than others. We can also add some filler right here. We can also add some chin support. So sometimes patients have a very recessed chin and they want bigger lips, or they just want a stronger profile. We can add a little bit of chin support to either project this way or to project down, depending on our proportions. And then to the side of the face, we can add some filler to jawline, the back of the jawline, and also pre-jowl sulcus. So this is a little hollowing that sometimes we get right here. So if we strengthen that, then it can help with our jowls because we're kind of just pulling things above and below. So that's some common areas that we can inject in the face. But as you can see, it's a bit more complex than just under eye filler or cheek filler. So if you come in for that filler appointment, then we'll do a full assessment and we'll determine, hey, you need a little dot here, a little dot here, a little dot here, and we'll balance you out and give you a price quote based off of that. So onset, how quickly does this stuff kick in? You actually see it right away. So with it being a jelly type substance, it's not like Botox where you have to wait for it to kick in. You'll leave the office and you'll see it. Now, with that being said, you'll be a little swollen, you'll be a little red, irritated, you'll be a little puffy, you can have some bruising. If we did lips, I like to do a dental block with that, so the numbness takes about an hour to wear off. Just don't plan any important events right after, but it's an amazing treatment to see results very quick. It takes about 2 weeks to settle and even up to a month to kind of fully integrate. So I tell most people don't judge it until about 2 weeks. And then you might still have a little bump here or there until about a month. Duration wise, how long does it last? Typically about a year. Every product's a little bit different, but roughly about a year. We kind of covered the areas already. Pricing, I like to price based off of percent correction. So whenever you get a quote from me, it'll be, let's say, $1,400 for 50% correction or $2,100 for about 75% correction. Because I don't just want to quote you based off of syringes, 2 syringes. What does 2 syringes for a facial balancing appointment mean to you? It means nothing. You're like, I don't even know what that means. So you're coming to me to have maybe less of under eye hollowing, a little bit more cheek support, a little bit of a jaw pop. So I'll say, hey, for $1,400, we'll have about 50% correction. And you'll say, oh, okay, that's understandable. So that's my goals with quoting. But if you're a syringe kind of person, it's roughly about $700 per syringe. Now for lips is a little bit different. Lips, you pay for the overall outcome and the experience. So lips are a flat fee, $700 and $700 always. So if we inject today, we inject until we're both happy. I show you the mirror, we make sure we agree. You let that settle, and then if 2-3 months go by and you say, hey, I want them a little bit bigger, I want to add some volume, that allows enough time for that lip tissue to expand, for it to fully integrate, and then you can add more at that time, and then it would be another $700, a flat fee. I like to base it off of that. That way you get your full correction, your full goals, and you're just paying for the experience. Downtime overall, so for any filler, expect to be bumpy, bruisey, swollen, but don't let that deter you. I use techniques like a cannula technique that's blunt tip, so I'm actually not going sharp under the skin a lot of times. Now I still inject with needle too, but that's just some little tips and tricks that I have to make it a little bit more comfortable for you. Pain, don't be scared of pain either. We have lots of tools like topical numbing, vibrating tools, squeezy balls for stress. I change out my needle to keep it sharp the whole time. And for lips, I do dental blocks. Lots of my patients leave and they're like, Candace, I didn't even feel you touching my lips. I don't even know if I have the lips. I'm so numb right now. So that's my goal, to make it more comfortable and more tolerable so you actually want to come back. So overall, filler, my goal is so you look natural, you look refreshed. I don't want to shove 87 syringes of filler in you and you look like a big old monkey. Like, that doesn't look good. I want you to be soft, subtle, natural. I want you to look like yourself. So if you have any questions, look at my before and after pictures. That's a good example of my style, and we gotta make sure we're a good fit, but hyaluronic acid filler is an amazing option for you.